आपने किया वो होता है टाइम हो गया ये इन्होंने चेंज कर दिया मेडिकल एजुकेशन हाँ जी ऑन है आवाज म्यूट की हुई है या स्टूडेंट्स को जा रही है इधर कर देते हैं ये लिखा होता है एक दफा बिस्मिल्लाहिर्रहमानिर्रहीम अस्सलामु अलैकुम I'm sorry I'm starting this next session a little late for two reasons. One was that the medical education department did not convey to me that the timing of the lecture is 8:45. And secondly, in Lahore there is not lockdown and it is raining as well. Well, yesterday we talked about the immune system and I told you, in fact, there are certain points that you need to remember. And I just will take another 5 minutes just to tell you that what is important for you and what you need to remember, and that is that you all know that God has blessed you a system for protecting yourself from different microbes, non-microbes, toxins, tumor cells, degenerating tumor cells, necrotic tissues, and many other non-microbial foreign bodies, and that immune system works. It protects you, but if it is deficient, there are diseases. If it overreacts, there are diseases. If it is directed or misdirected against your own cells, then you call autoimmune diseases. So these are different types of diseases. You need to remember the different microbes, or you call the invaders, or those who initiate the immune system or who initiate the immune response. Number one. Number two, you need to remember what can happen if there is a deficiency of immune system, or your immune system is suppressed, or it overreacts and hypersensitive, or it reacts against your own cells of the body, your own cells. So number three was that I told you yesterday, there was a message that the slides were not moving. This was second slide, and I told you that the only thing you need to remember is sometimes the question is tabulate the differences between innate and adaptive immunity. So there are two types of immunity, innate and adaptive. You need to remember 2, 3, 4, 5 things that this adaptive is a specific immunity and which has got a memory, whereas innate immunity is a non-specific immunity in which there is no memory. So the second, if the antigen enters into your body for the second time, nothing happens. But here, there is a memory, and that prevents you in certain occasions, or many occasions rather. And the second thing important to remember in this slide is that there are three components. One is the barriers, the other is the cells involved in the immune system of innate immunity or adaptive immunity, and the third is the soluble proteins, which are in the shape of complements, cytokines, chemokines, interleukin, and here in adaptive it's called antibodies. So this was the first component of the innate system, and I forgot to tell you what are these CDs. CDs is the cluster differentiation. This nomenclature was established in a scientific conference in 1980.
Hello. Excuse me, sir.
Hello.
Sir, slides show नहीं हो रही, आपकी slides move नहीं कर रही.
Wait for a minute. I'm sorry.
Sir, कल भी ऐसे ही.
वो कह रहे हैं अभी भी slide move नहीं कर रही. Is it? Can you see it now?
No, sir.
It's only the first slide.
जी sir, first slide.
बुलाओ यार उसे सेकंड इट इज नॉट मूविंग और आई एम सो सॉरी. Well, it's just yesterday's revision, so till the time the boy comes, this IT boy comes, let's finish it. So I was telling you the first component is the physical barrier, and the barrier they start right from the eyes to the toes, the eyes, nose, yes, your tonsils, your adenoids, your turbinates in the nasal system, your mucosa, bronchial mucosa, and the chemical barriers, digestive. In the stomach, you have got gastric acid, and in the vagina, you have got the low pH, acidic pH. They all prevents the microbial growth. Those chemical barriers, they prevent the microbial growth, whereas the other barriers, they do not let the entry, they stop the entry of the microbes or other foreign elements. Yesterday, this was the only thing which I forgot to tell you, and that was these. Excuse me for a minute. यार बात सुनो बच्चे. Well, this nomenclature was given for the identification of different. There is a lymphocytic variability. In fact, whenever there is an entry of an antigen, ये यार ये slide तो move नहीं करती. I'm sorry for the delay. Does it work? Okay. पूछें ये किसी एक में अनम्यूट करके पूछ लेते हैं.
Alina Tariq? Hello?
Are you there, Alina? No. ये और को. ये बच्चा. अनम्यूट किया. हेलो. कंटिन्यू क्या करें जब उसमें. Well, cluster differentiation, whenever there is an entry of an antigen, I have told you that there is, you call it a lymphocytic variability, or the lymphocytes in the progenitor or the bone marrow, they recognize, they have got the receptor. The CDs are the different types of chemical substances or chemical molecules which you call receptors. And there is a clonal diversity. So certain clones of lymphocytes, they are being recognized by the lymphocytes, and those clones, they divide. So this numbering is CD15 is for granulocytes, 14 is for monocytes, 15 and 56 is for NK cells. These are not very important, but these numbers CD4 and CD8 are important for immunity.
ये अब दोबारा देखना. अब चेक करना. अब फॉरवर्ड हो रही.
किसी और से पूछ लो कि उसके अपने सिस्टम में प्रॉब्लम. So, well, I was telling you that this expression of receptors or molecules you call clonal diversity. So, when the antigen enters, there is expression of certain molecules, and this is the nomenclature of those molecules. So, the important are only CD4, CD8, and CD19. And CD19 is for plasma cells, CD4 and CD8 are for T cells. Well, these are different cells which are shown. ये अनम्यूट करके पूछ लेते हैं. ये है क्या अनम्यूट करें?
बच्चों को करना है.
हाँ, पूछें पार्टिसिपेंट से.
बिलाल अमीन.
जी सर. सर स्लाइड नहीं चल रही सर. कल का लेक्चर भी ऐसे गया है हमारा. कल भी स्लाइड नहीं चली कोई भी. ये टेक्निकल इशू आ रहा है रोज का.
Is it only in the lecture of pathology or in all lectures?
सर पैथोलॉजी पैथोलॉजी.
Only in pathology.
सिर्फ
ठीक
pathology.
है, चेक कर लेते हैं अभी 1 मिनट से.
अच्छा, आप इस
सर
पे
कल का लेक्चर भी कोई स्लाइड मूव नहीं हुई हमारी.
वेट फॉर अ मिनट. इस पे इंटरनेट चल सकता है कहीं? इसमें ना कोई प्रॉब्लम हो, इसमें कोई वायरस हो
सर वो
यूएसबी में.
आ रहे हैं अंकित भाई, वो करें चेक कर.
ये देखो, ये स्लाइड्स नहीं मूव कर रही इतनी देर तक. ये मूव नहीं करती.